Hello and welcome, everyone. I'm John M. Hawkins. The show is My Strategy. We're coming to you live from the BBM Global Network and TuneIn Radio. We're very happy to be here with you today and glad you can join us. My Strategy episodes are live and on Saturdays at 10 a.m. Pacific, 1 p.m. Eastern. Today, we're going to be talking about social distancing and COVID-19. We're going to talk about the impact of social distancing from this pandemic, the near-term and long-term effects. We're going to discuss the impact to people. How long the social distancing may last. We're going to talk about ways to solve social distancing challenge with technology, and we're going to help you develop a strategy. We're very happy to be here with you today. Saturday is a great day of the week to reflect on our strategies. It's the day that I choose to reflect on my strategy, but keep in mind that any day is a good day for you. Our show is growing and continues to grow. We're on iHeart, iTunes, Player FM, YouTube, SoundCloud, Spreaker, and many more digital platforms. So if you'd like to listen to this episode or any of the prior episodes, you can go there. We're up to 71 episodes now, so we're moving right along. You can find me on most social media platforms. My Twitter handle is @HawkinsJohn. My website is johnmhawkins.com. So that's Twitter @HawkinsJohn. And the website is johnmhawkins.com. And just like anything in life, we need to have a strategy and a plan to help us reach our goals because the best laid plans don't always work. This week, I'm looking for your stories on social distancing. What have you been going through? Tell me what you've been doing, what you've been up to. If you have a good example or you have a tip or a trick that you've been using as you've been staying in place, please send it to me at talk@johnmhawkins.com. That's talk@johnmhawkins.com. Would love to hear from you. All right, so this week we're talking about social distancing and COVID-19. Now, social distancing has had a big impact. And what is the near-term impact? But more importantly, what is the long-term impact? What's going to happen? We're going to talk about how engagement has diminished, how we're now being forced into distancing. We're going to talk about the impact to people and what this social effect is, what the mental effect is, who's likely to be affected. And actually, we can learn a lot of lessons from 1918 when we had that prior pandemic. We're going to talk a little bit about the social distancing and how long we need to social distance. For example, when they give the all clear, are people going to feel comfortable and go back into society and, be as we were, or are they going to carry out some of these social distancing? We're going to talk about that. We're going to talk about ways you can measure social distancing policies, specifically through technology and the implications there with regard to GDPR and other privacy concerns. And then we're going to help you develop your strategy because at the end of the day, we are all in this together. And why not work together to help solve this problem? Coronavirus disease 2019, called COVID-19. This is from the Centers for Disease Control and Prevention. Social distancing, quarantine, and isolation. Keep your distance to slow the spread. Limit face-to-face contact with others is the best way to reduce the spread of the coronavirus disease 2019. What is social distancing? Social distancing, also called physical distancing, means keeping your space between yourself and other people outside of your home to practice social or physical distancing. Stay at least 6 feet apart from other people. Do not gather in groups. Stay out of crowded places and avoid mass gatherings. It says, in addition to every step to prevent COVID-19, keeping spacing between you and others is the best tool we have to avoid being exposed to the virus and slowing its spread locally and across the world. When COVID-19 is spreading in your area, everyone should limit contact with close individuals outside of your household in indoor and outdoor spaces. As people can spread the virus before they know they are sick, it is important to stay away from others whenever possible. Even if you have no symptoms, social distancing is especially important for people who are at higher risk of getting sick. So they go through here on the website, the CDC website, and go through social distancing tips and tricks and all the things we can do. And I'm not going to go through those because we've heard them probably multiple times every day, have them memorized. But from that perspective, this is a completely different stance to what we did just a few months ago. It is something that has really impacted us. I've got an article here from Stephen Sack. It says, "I miss you too, grandmother." He's talking about social distancing and how it worked against the deadly 1918 flu. It says here, weeks after a mysterious and uncommonly lethal virus began sweeping through the world, Los Angeles mayor declared a state of emergency. Though the pandemic had yet to affect the city in large numbers, only a few confirmed cases had been identified in Southern California. City and health officials took swift action before this highly contagious disease could get its hooks established. The same day, city officials banned public gatherings, shut down entertainment venues and schools. Infection spread nonetheless, and leaders asked Angelenos to make more drastic measures, staying inside and using their telephones to buy groceries and necessities in a desperate attempt to keep people safe. Sadly, many of them foolishly ignored the advice. In the absence of the vaccine for this new viral killer, city and health officials correctly concluded that social distancing policies to limit the crowds were the wisest course of action. They disinfected public places and debated whether to require people to wear face masks in public as well. Now, it says here this could easily account for the steps they've taken in March of 2020. But in reality, everything that we've just talked about is from the fall of 1918, over 100 years ago. This is drawn from historical records in the Los Angeles Times archive. The LA mayor was Frederick T. Woodman. California's governor was William D. Stevens. And the world was in the grips of a devastating influenza pandemic that would ultimately kill some 675,000 Americans and 50 to 100 million people worldwide. It says here that in some respects, comparing the H1N1 virus from 1918 to the novel coronavirus caused the pandemic isn't particularly useful because we have different viruses, and trying to apply lessons from one to protect the other is risky. So we know there's a lot of science going on. There's a lot of work to try and find vaccine cures, antibody testings, and other things. Here it says, of course, no one called it social distancing back in 1918, but the strategies in Los Angeles, Pasadena, and other Southern California communities employed then to fight the virus when there was no medication or little scientific understanding. Bear great resemblance to what we are trying now. Do we wear masks? Do we not? So the situation is very similar to what they experienced in 1918. People have to, they didn't call it social distancing, but now we're calling it social distancing. And the question is, what is the impact of all of this on us as a society? You know, many times, just even a few months ago, we looked at our children and said, you're spending too much time, too much screen time. You know, get out and be interactive. You're spending too much time playing video games or watching TV. Get out and be interactive. And now that we have this pandemic, now that we have this virus, we are doing exactly what we didn't want our children to do months ago. We want them to be distant, and we want them to be engaged in that. You're listening to My Strategy. I'm your host, John M. Hawkins, coming to you live from the BBM Global Network and TuneIn Radio. When we come back, we're going to talk about the impact to people, their social effect and mental effect. We'll be right back. Hello and welcome back, everyone. I'm John M. Hawkins. The show is My Strategy. We're coming to you live from the BBM Global Network and TuneIn Radio. Well, if you're just joining us, very happy to be here with you today. Really glad that you could join us. Episodes are live and on Saturdays at 10 a.m. Pacific, 1 p.m. Eastern. Would love to get your thoughts. You can send us an email at talk@johnmhawkins. That's talk@johnmhawkins.com. And this week, we're talking about social distancing and COVID-19. Right before the break, we were talking about social distancing, the impact it is having. We talked about 1918 18 and looked at some articles from there and found that what happened back then is very similar and reminiscent of what we are seeing today. In this segment, I want to talk a little bit about the impact to people, the social effect, the mental effect, who's likely to be affected. I've got an article here called The Impact of Social Distancing by Tom Lambrick. He says, we've a new phrase in our vocabulary, social distancing. In this time of the novel coronavirus, keeping distance from others can help stop the spread of the disease. It is iconic to me that this virus has caused an extreme form of what our society has already been doing. In 2000, sociologist Robert D. Putnam wrote the book Bowling Alone. Doesn't sound like fun. The Collapse and Revival of American Community. Based on over 500,000 interviews, Putnam demonstrated we sign fewer petitions, belong to fewer organizations that meet, know our neighbors less, meet with friends less frequently, and even socialize with our families less often. He says our society has become less socially engaged. I think the supreme example for me was watching a young couple eat dinner at a restaurant, each one of them buried in his or her own smartphones and not talking with each other. Even those things we do together, we no longer do together. It has been said that in order to communicate with a teenager, you do not talk to them or call them on the phone. You just text them or message them on Facebook or contact them through Instagram, Snapchat, or any other digital platform. He says now we're being forced into an even greater social distancing. This is from the coronavirus. Sporting events canceled. School classes canceled. Church services canceled. Everything's being canceled across the country and the world. We're no longer supposed to be gathering in groups of 10 or more. I've heard 2 or more people. And some parts of the country are telling their residents to shelter in place, except for essential errands. He says Joni Mitchell captured what I'm feeling with her 1969 song Big Yellow Taxi. The refrain contains the line, "Don't it always seem to go that you don't know what you've got till it's gone?" We often don't appreciate something until we don't have it anymore. And think about that. Just months ago, what he said here with regard to us sitting at dinner tables, heads tucked into our smartphones, texting people, and now all of those opportunities are gone. We had the opportunity to talk to people. We had the opportunity to go out with friends. We had the opportunity to go visit our loved ones, and now we can't do it. He says he wonders if the current crisis is here to help us reinforce the value of human connection. The coronavirus is taking us to the extreme of what we've been doing as a society, distancing ourselves from each other by taking away for a time all the opportunities for fellowship in person. Perhaps we will become aware of what we are missing in our lives. Humans are made for personal connection. Some thrive on more connections, while others on less, but we all need it. He says maybe when this crisis is all over, we'll seek to rekindle the human connection that we have been missing. Got another article here that talks about the mental implications of social distancing. And I apologize, I don't have the author. It says here, what are the mental health implications of social distancing? If you've read about the health benefits of touch, you might be wondering how social distancing can affect your well-being over time. After all, no one exactly knows when the coronavirus pandemic will end. First off, it's true that social distancing could have some negative implications, says Barbara Nosel, Ph.D., Chief Clinical Officer at Newport Academy. She says, we are a high-tech society, but we are also a high-touch. So limiting our physical interactions can lead to the feeling of loneliness. Social distancing measures can make people feel more likely to isolate themselves. Right? Think of all of you working from home, which can create problems. When humans are isolated from one another, they may become more prone to feelings of anxiety, It's also important to note that while working from home, staying home from school, or being confined to a room while in quarantine, there is a reduction in physical touch. And think about that. In your day-to-day life, you go through life meeting people, shaking hands, talking to people, embracing. And all of a sudden, all of that stopped. Going into work, talking to coworkers, getting things done, it all stops. No more lunches. And it really is truly can cause health issues with people. He says here that what's truly heartbreaking is that the elderly, who are among those at a higher risk of suffering serious complications from the coronavirus, may be the hardest hit by the negative impact of social distancing. The elderly might be greatly impacted by social distancing because they often look forward to visits from family members or friends, says Prairie Conlon, director at Certa Pet. With fears skyrocketing, she would predict a drastic decrease in visits to nursing home and elderly care populations. In other words, go FaceTime your grandparents. While social distancing is strongly recommended among the coronavirus pandemic, constantly focusing on these measures and other coronavirus-related topics can take a big toll, says Conlon. Through social distancing is a concern. As a mental health clinician, she is more concerned about the hysteria brought on by this virus. She explains those who have not struggled with mental health symptoms in the past are reporting panic attacks, which can be an incredibly frightening experience and many times end up in emergency room visits. She goes on to discuss some of the panic attacks and what that means. Lots of good information out there with regard to what can impact us from a social perspective. There's other good information in the support for nonprofit Science Journal. It's a free publication, and they talk about some of the effects of physical distancing and how over a long period of time, social isolation can increase the risk of a variety of health problems like heart disease, depression, dementia, and even death. So lots of information out there with regard to some of the health implications. You're listening to My Strategy. I'm your host, John M. Hawkins, coming to you live from the BBM Global Network and TuneIn Radio. When we come back, we're going to talk about when will social distancing end. I'll be right back. Hello and welcome back, everyone. I'm John M. Hawkins. The show is My Strategy, and we're coming to you live from the BBM Global Network and TuneIn Radio. Today we're talking about social distancing as a result of the COVID-19 pandemic. Right before the break, we were talking about the impact to people, social effect, the mental effect. Who's going to be affected? What are we going to miss? In this segment, I want to talk about when will social distancing end? I think that's the big question that everybody's asking is when will this end? How long will it take for us to get back to normal? When will people go back to work? Got an article here in Live Science by Nicoletta Lance. She says, when will all of this end? In states across the cities in the United States, government officials have ordered residents to stay at home, shelter in place, and otherwise put family routines on hold to quell the spread. She says to adhere to these executive orders means staying at home from work and school for weeks on end, only mingling with members of your own household. No family, no extended family or friends. Maintain at least 6 feet space between yourself and the next person in the line at the grocery store. But increasingly homebound people, boundaries when you're out exercising, etc. So the big question is, when will things get back to normal? She says the real answer is that no one knows yet. But in all likelihood, some amount of mandatory social distancing, quarantining, and travel restrictions could remain in place for months to come, several experts told Live Science. The exact number of months will remain indefinite until scientists can access reliable data to track the disease spread, develop effective treatments and vaccines, clarify key details of the virus biology, such as whether its spread may slow in warmer months or not. She says, but regardless of how the pandemic meets its eventual demise, Americans must now contend with the ongoing spread of the virus, which means you stay home. She tells her family, this is our new normal. We're going to get used to it, says Julie Swan, head of Fitz Department of Industrial and Systems Engineering. From a scientific point of view, we don't have a choice, says Lillian Elisa, director of the Center for Resilient Communities. We still have individuals who are working off the old normal, and that's terrifying, Elisa says. This is going to be the new normal for an indefinite period of time. If you don't excuse my language, pull your head out of something and stay home for a few weeks, you're going to be causing the problem to worsen. In the United States, we have plans in place to try and slow down the spread of COVID-19. And will any of this work? That's what is yet to be determined. I've got an article that talks a little bit about that. It says White House coronavirus officials says effect of social distancing won't be seen for many days to come. And the reason that is, and this article is by Madeleine Carlise, the reason for that is that it takes 14 days for people to catch the virus, get sick, and end up in the hospital before we know that there's a problem with them or not. So you've got a 2-week period where they might be sick, they could have the sniffles, and then all of a sudden they have complicating factors and they're in intensive care on a respirator and fighting for their life. So what they're trying to do is flatten the curve. And this was a statement from Savannah Guthrie, who asked Dr. Bricks about the comments that things were going to get bad. Savannah says, do you agree? And in what way should we expect that? Bricks says, what we're seeing in the hospitals now is that people who likely got exposed and sick more than 2 weeks ago. So you're seeing what was occurring 2 and 3 weeks ago, she responded. The things we have put in place over the last 8 days and what the mayors and governors of states have done won't be seen the impact of for at least another 7 to 14 days. They're also looking at the impact of the epidemiologically to see how this disease spreads. So from a when will this end perspective, the scientists have to have a good assessment. They have to look at their models. They have to be able to, with a high degree of certainty, be able to show that when they do open the nation back up, that they're not going to see an increase in cases, that they've got mitigation strategies in place, that they have a way to handle it. And I think about from a personal development perspective, isn't that what we do on a regular basis? You as somebody who is trying to accomplish goals, you're trying to accomplish your objectives, you've got the best plans out there. You are working along towards those plans. You're getting to the goal. And then something catastrophic comes up. Something comes and you weren't expecting it, and it hampers what you were trying to do. And that is exactly what's happening at a national level, is that the whole country has stopped. And it stopped because something came up that would drastically impact the health of us. And when I look at this from, flattening of the curve and trying to take these protective measures, really our own personal development, our own experiences all are very similar and parallel to what's happening on a national basis. Now, our own situations are things that we run into. Not everybody is impacted by what happens to us, but these setbacks now are common amongst all of us. So there's some connectiveness there. There's some, reassurance that you're not the only one who's in this situation. You're not the only one who has to deal with this. And so as we start to think about our plans and how we go about getting through this and become confident that we have a way to do it, how can we help others? How can we help others get through this hard time? And I think that's really what's going to be important. It's not when will this end, but it's how are we going to come together? How are we going to support each other? How are we going to figure out a way to move forward? And whether it's 2 months, 3 months, 5 months, it's very difficult for us to know. You know, you've got a highly infectious disease that can spread very quickly between groups. And, you know, you just don't know unless you have all the data. And at some point, somebody's going to have to make a decision based on the data set that they have. And they're going to have to look at the models, and they're going to have to say, you know, we've got enough measures in place so that we can get back to business as usual. We have enough protective, equipment that people can wear. Maybe it's masks. Maybe it's some sort of, antibodies test. We just don't know. And I think from that perspective, as we're putting together our own plans, we want to think about this being a longer term closure rather than a shorter one. And if it is shorter, we'll be ready. You're listening to My Strategy. I am your host, John M. Hawkins, coming to you live from the BBM Global Network and TuneIn Radio. When we come back, we're going to talk about technology and measuring the effect on social distancing. We'll be right back. Hello and welcome back, everyone. I'm John M. Hawkins. The show is My Strategy. We're coming to you live from the BBM Global Network and TuneIn Radio. We're very happy to be here with you today on this Saturday and really glad you could join us. My Strategy episodes are live and on Saturdays at 10 a.m. Pacific, 1 p.m. Eastern. We'd love to get your thoughts if you send an email to talk@johnmhawkins.com. That's talk@johnmhawkins.com. We would love to hear from you. Now, if you're just joining the show, this week we're talking about social distancing and COVID-19. We're talking about the impacts of social distancing from this pandemic, the near-term and long-term effects. We're discussing the impact to people. How long will social distancing be around for? Talking about technical solutions to track distancing, and we're helping you build a strategy. All right, before the break, we were talking about when will social distancing end? When will we get to that new normal? How long will it be? Unfortunately, I don't have an answer, but I can tell you they are making progress on tracking the disease and trying to make sure that we're as safe as we can. In this segment, I want to talk a little bit about the effect of social distancing policies and some things to consider, such as, what are the technology and ways we can track those infected. I've got an article here from the CIO Journal. It's called Measuring the Effectiveness of Coronavirus Social Distancing Policies by Irving Wladowski-Berger. It says one of the most interesting projects in the MIT Connection Science Group they are affiliated with is the Atlas of Inequality. The project, led by Esteban Morro and Alex Sandy Pentland, uses aggregated anonymous geolocation data from digital devices to estimate where different groups of people in the U.S. cities spend their time. So this is taking your smartphones, your tablets, your laptops, and anytime it says, do you want me to know where your location is, and you allow, puts a GPS point out there, and what they're doing is taking that data and doing some modeling with it. It says the Atlas Research Group started to apply their geological data and methods to analyze the effectiveness of social distancing policies adopted in the New York metropolitan area in response to the coronavirus pandemic. There's no way to empirically measure the impact of these social distancing measures in real time on the spread of COVID-19, the respiratory disease caused by the virus. You can only measure the impact retrospectively or simulate what might happen in the future. So they're saying you can't predict where people are going to go. You can't predict what they're going to do. But once they've gone there and done that, there's ways to track them with that geodata. However, you can empirically address a key set of important questions, including how social distancing policies changed mobility and social behavior to the extent to which people are following these measures. The initial findings revealed that the area's social distancing policies have led to major changes in where people spend their time and how they interact with each other. The number of social contacts in places decreased by 93% from 75 to 5, says the report, where social contact is defined being within 25 meters or 82 feet apart of each other for at least 5 minutes. Also, social distancing policies have greatly reduced relative differences between different demographic groups, as nearly everyone's mobility and social contacts have been dramatically reduced. The change became significant only after non-essential business closure measures were put in place. Retail, food, and essential supply stores are now the most common places for social contact, which makes sense. If you close all the businesses, except the essential ones, you're not going to see people congregating or being within so many feet of each other at those normal stomping grounds, but they're going to be at the essential places. It says after those measures were introduced, about 5.5% of New Yorkers started to spend time in places beyond the metro area, including New Jersey, 37%, upstate New York, 23%, Pennsylvania, 9.8%, and Florida. It says more detailed findings can be found in the draft report. Let me briefly describe the source of data used in analysis as well as methods to preserve the privacy. So this is interesting. In 1918, when they had this, they wanted you to social distance. They didn't call it social distancing, but stay apart. And when we look at the data here, we also see spikes and upticks in the disease in these areas that are mentioned here, like New Yorkers that moved to New Jersey or those that moved to Florida. So we have a technical way that we can track people's movements and their social distancing. And from that perspective, the question is going to become, if we can track people's data and if we know exactly where they are, wouldn't it be nice to be able to track everyone, and then you would be able to concretely know who has been infected, who they've been near. And this is something that the central government in China did to combat its COVID-19 outbreak. However, in the U.S. and other free market democracies, there's a certain thing that keeps us from doing that. And as a result of that, there's privacy laws. So those who are going to be tracked have to opt in and say, it's fine if you track my data. For the others, they're not going to be able to do that. It says the primary source for data is for the Atlas of Inequality Project is anonymized data, location data from a variety of applications on smartphones. The data comes from Cubic, a geological-based intelligence and measuring company, and in particular from Cubic's Data for Good initiative, which makes this data available for academic research and humanitarian programs. So as they go through here and find ways to be able to track where we are and what we're doing, there also is the general data protection and privacy that has to be thought of. So in the case of Cubic, it's anonymized data, which isn't going to give information about those of us, our cell phones, and who we are, but it is going to be able to give you patterns and trends. Net, I think, for those who opt in and want to show where they are, what they've been doing, it's a data point, right? You can extrapolate and be able to do some calculus from those people, where they are, what they're doing, and that could help with the modeling. We can't do it for everybody for obvious privacy reasons, but as you think about it, there is a way that technology could help us slow the spread. Technology could help us flatten that curve. And if we do it right, it can provide lots and lots of insights and help us get back to work sooner rather than later. So this, I thought, was just really interesting, how technology is now in place for us to be able to help track our behavior. It can help us reduce the spread of this virus, buy some more time so that they can find a vaccine, or we develop antibodies and have some sort of way to prevent the spread of it. You're listening to My Strategy. I'm your host, John M. Hawkins, coming to you live from the BBM Global Network and TuneIn Radio. When we come back, we're going to talk about developing our social distancing strategy. We'll be right back. Hello and welcome back, everyone. I'm your host, John M. Hawkins. The show is My Strategy, and we're coming to you live on the BBM Global Network and TuneIn Radio. Today, we've been talking about social distancing and COVID-19. Right before the break, we were talking about flattening the curve and ways we can use technology to help reduce the impact of coronavirus on society. In this segment, I want to talk about developing our social distancing strategy. How do we observe our emotions, create a checklist and a plan to track your progress? Are you doing the right things to stay fit? Well, I think that, one of the things that can be said is while nobody wants to be thinking about COVID-19, nobody wants to be doing all these social distancing practices, at the end of the day, we all have to do it. We don't have a choice. It's like death and taxes. You're going to have to do both of them at some point. And we are in a situation where we do need to social distance. We do need to make sure that we prevent the spread and flatten the curve of this. So from that perspective, every week I talk about building your systematic approach, and I've got a very simple 5-step process that I go through. And it's 5 steps because I have 5 fingers, and I can think about it, and I am able to go through it pretty quickly. But, it's number 1, it's the awareness. What are we trying to accomplish here? What's our visions and goals? What are we trying to achieve? Assess and analyze. How do we assess the situation? What's the analysis that we can do to help us determine what are some of the likely steps that we could take? From there, the third is strategize and plan. We need to come up with a course of actions to determine what we can do to help accomplish this goal. Fourth is implement the plan. We have to start doing something, make changes, break habits. And finally, we need support and evaluation. If the plan's not working, why? Who's accountable? Who's responsible? Do we have what we need? Can we find help, etc.? So with respect to social distancing and thinking about that, obviously, all of our activities on a daily basis have changed. It's an amazing thing because we've broken habits that we might have been doing for years. Going to go get coffee, you're not doing that anymore. Going out for lunch with somebody on Tuesdays, you're not doing that anymore. Now, it's pretty amazing that this policy comes into place and all those habits that we had are now broken. The challenge becomes we had habits, some good, some not so good. But what we need to do now is figure out how we replace those habits with good activities. And, one of the things that I want to talk about is how do we overcome some of those emotional effects. And I've got an article here by Paula Durlovsky, PhD. She says, like many in our community, she's feeling anxious and fearful for the unknowns related to this crisis. Anxiety is a normal reaction to stress. For the next several weeks, everyone in our community will be practicing social distancing. The closures of schools, colleges, non-essential businesses, restricted gatherings, and other types of in-person interactions or efforts aimed at stopping or slowing the spread of an infectious disease. Not surprisingly, social distancing can result in us feeling even more anxious, fearful, depressed, and lonely. And those with pre-existing mental health conditions might experience new or worsening symptoms, since social distancing equates to less social in-person interactions. The behaviors known to improve our well-being reduce symptoms associated with depression and anxiety. So the question is, what can we do to address our emotional health during the COVID-19 pandemic? And she gives us some ideas and things we can do. So as we're assessing our strategy, as we're going through those checklists of things, this is one of those things that we're going to have to deal with. We're going to have to take a look at our well-being, take a look at if you are fortunate enough to be sheltering in place with other family members, monitor the family members. If you're not, reach out to those who are vulnerable, grandparents, parents, friends who live alone. they all could be going through this. So let's go through this and see, what she has to say with regard to these steps. Keep a mental note and check off the ones that you're doing. If there's something here that's not listed, it might be something to consider and add to your strategy. The first one she says is observe and describe your emotions in a non-judgmental way. Some people naturally run hotter than others when it comes to experiencing strong emotions like anxiety. The strategy entails observing of your surroundings and circumstances and describing your observations in words. I think this is good from an assess and analyze perspective. You have to have a non-judgmental clinical way to look at how you're feeling, which is near impossible. But really think about it from that perspective. Try and gain that perspective so that when you're looking at your own emotions, how are you handling this? Are you handling it well? Are you not? Have a distress tolerance plan. She says, we're all experiencing anxieties with today's new reality. Having a plan for calming down when you have those strong emotions is going to help us. So if you do find a situation where you are stressed beyond belief, what is your plan? How are you going to calm down? What are those things that you've done in the past to calm down in stressful situations? We have to put a plan in place to deal with this. She says take regular and frequent breaks from watching, reading, or listening to the news. Being exposed to the news 24/7 about the pandemic is not only emotionally upsetting, but it's bad for our physical health. So are you watching it frequently, regularly, keeping up on the statistics, watching the death toll? A lot of that can have an impact on your health and well-being. Here's a good one. Take care of your body. Try to eat healthy, well-balanced meals. Exercise regularly. Get plenty of sleep and avoid alcohol and drugs. Make meditation a daily self-practice. The studies analyzed in the Journal of American Medical Association show that medication does help manage anxiety. The focus of mindfulness meditation is to that meditation does help manage anxiety. The focus of mindful meditation is to train the brain to stay quiet at the moment. So that's something you could try in case you're looking for something. Create meaningful interactions with your family. Although a pandemic is not something that one would ever hope for, take advantage of the time you have. Connect with other family members. Connect with the children, partners, pets, and friends. Play board games, cards, watch movies, etc. Also suggest using social networking sites and virtual platforms for staying connected. Connect with nature and know that you are not alone. We are all going through this. So some ideas for your strategy. You're listening to My Strategy, coming to you live from the BBM Global Network and TuneIn Radio. When we come back, we're going to help you put your plan in place. We'll be right back. Hello and welcome back, everyone. I'm your host, John M. Hawkins, coming to you live from the BBM Global Network and TuneIn Radio. The show is called My Strategy. Right before the break, we were talking about developing your social distancing strategy and hopefully helping you put a plan in place to deal with some of the anxiety that you might be facing as you shelter in place. In case you missed this broadcast, you can listen on iHeartRadio or Apple iTunes. Or if you'd like to have something covered on the show, you can send an email to talk@johnmhawkins.com or just pick up the phone and call me at 844-MY-STRATEGY. That's 844-MY-STRATEGY. Today we've been talking about social distancing and COVID-19. We've been talking about the impact of social distancing, the near-term and long-term effects. We talked about the impact to people, how long social distancing can last, technical solutions to track, and how to develop a strategy. Well, this COVID-19 wasn't anything that we'd expected. We do know that there were lessons from 1918 where we did have a pandemic that took the lives of 675,000 U.S. citizens and 20 to 50 million globally. And we're now faced with a invisible enemy, a virus that is highly contagious, and not only highly contagious, but impacts respiratory, and as a result of that, people who have compromised immune systems or are not healthy, and in some cases are healthy, they're still dying from it, which has caused us to go into social distancing. Challenge with going into social distancing is that we're in a society where we had fewer social connections, and now we're being forced to the extreme where we can have next to none. And human connection is important. It's important because there's a social effect, there's a mental effect, there's certain people who are going to be affected more than others. Namely, older people really rely on having family come and visit them. You know, they don't have things to do every day like many of us, and as a result of that, they look forward to having somebody come visit them on a Saturday or a Sunday. They look forward to picking up the phone and having somebody on the other end. They need somebody to bring them their food. They need somebody to do the grocery shopping. So this whole social distancing that's been put in place has had a dramatic effect not only on you, but all of those in this country and around the world. So the question becomes, well, how long will we need to do this for? When will this social distancing end? Or will it become our new normal? And unfortunately, the answer is that we don't know how long this is going to take. We don't know when people will be able to go back to work. We don't know if it is going to end in a week, 2 weeks, 10 weeks, 6 months. But there is hope. As they do, study the disease and find out vaccines and look at antibody testing and figure out who's had it, they're going to be able to put a plan in place to get everybody back to work. Now, will we be social distancing in the near term? A habit takes 21 days to form. The fact that we've been in lockdown for over 21 days tells me that, yes, we're going to be in a habit of social distancing. When anybody sneezes, when anybody, wipes their face, you're going to be concerned. So there's technology out there that can help us measure it. It can go out there and look at geolocation data. Smartphones may be a cure for us. Devices that show where people are going and when can help us at least understand who has the disease, where they are, and help put mitigation in place faster. So you're going to be able to get back to work, but you might need to be ready to change at a moment's notice. And finally, it's important for us to develop our own strategy, check our emotions, and make sure that we are healthy and in a good place. Well, you've been listening to My Strategy. I'm your host, John M. Hawkins. We're coming to you live from the BBM Global Network and TuneIn Radio. Thank you, and we'll see you next time.